And the questions that we asked in 2002 bear noting. We asked, what is driving unified command models? How can incident managers execute multi-layered emergency response and consequent management plans? When the quick surge in resources and manpower happens, what will hold it together and keep it on track? Those are the kinds of questions that we're still seeking answers to. And I think that here in 2004, 18 months after the first of our series, we're going to try and pick up the pace a bit and have the third about 6 months out in the fall of this year. I'd like to start by noting that on April 28th, the President came before the American people and laid out a plan, a directive, called Biodefense for the 21st Century. And he made it quite clear that in terms of biodefense and what we're discussing here, that is response to bioterrorism and interoperability, these things need urgent attention. I want to just quote briefly from what the White House issued on the 28th of April. While the public health philosophy of the 20th century, emphasizing prevention, is ideal for addressing natural disease outbreaks, it is not sufficient to confront 21st century threats where adversaries may use biological weapons agents as part of a long-term campaign of aggression and terror. Healthcare providers and public health officers are amongst our first lines of defense. Therefore, we are building on the progress of the past 3 years to further improve the preparedness of our public health and medical systems to address current and future biological weapons threats and to respond with greater speed and flexibility to multiple or repetitive attacks.
Framed up real nice.
And in this instance, what has happened is that we have seen a number of programs in motion, and these are all leading in the right direction. We have seen, even in the past week, further developments pointing to the fact that there is significant momentum behind this urgent need to improve communications and to address interoperability. We see the reorganization of the CDC, for example, just being announced within the past 24 hours. Although the Office of Terrorism Preparedness and Emergency Response goes untouched, we do have now the sense of continuity and momentum in terms of funding. We also have over at HHS, the HRSA announcing $498 million in awards to states to improve hospital preparedness. Again, we see continuity. And the emphasis, among other things, is on harmonizing communications. That is, building capability and purchasing communications equipment and making sure that hospitals have what they need in terms of interoperability. I won't go through the whole fact sheet, but HHS has listed a long series of accomplishments with respect to preparedness. And in terms of interoperability, they clearly recognize that that is one of the major objectives of their program. Communications work, despite progress to date, is not resolved. We still have interagency communications issues that we're wrestling with. The Public Health Information Network messaging system will be discussed this afternoon, but bear in mind that 1 million recipients can now be accessed on that system, including 90% of all county public health agencies, up from 68% in 2001, and that 1,800 public health officials can be immediately contacted through the EpiX system, compared with 200 in 2001. The readiness force of the U.S. Public Health Service is far greater, numbering 2,300, up from 600 in 2001. And in instance after instance, you can see progress. I won't go through all of the HHS improvements, but at the same time, there are people who are calling for more to be done. And specifically, the governors, the National Governors Association on May 20th, for example, urged HHS to honor its commitment to fund state bioterrorism preparedness efforts. So where I mentioned $498 million coming into the pipeline a moment ago, the governors are holding everyone's feet to the fire, if you will, to ensure that that is done. I finally want to, in my introduction, before I introduce our first speaker, Dr. Boyd, I finally want to just take a moment to share with you some observations from someone far from Maine. It's one thing for me, living on an island off the coast of Maine as I do, to come before this audience and to try and portray and characterize the state of readiness with respect to bioterrorism. However, it's another thing entirely for someone in an urban fire department, a major vacation destination on the East Coast, to offer his sense as to where we are today and where we're headed. So, I would like to thank Brian Will, who is Special Operations Training Coordinator for the Orlando Fire Department, for sharing with us this morning some of his thoughts about bioterrorism and preparedness. In response to biodefense, he says, and interoperability, are we ready? Yes. Are we prepared? Hopefully. Do we have a plan that works? Who knows? With bioterrorism, there are too many variables that affect the outcome. Will we get through it? Absolutely. Hopefully without suffering any losses. I want to stress that drills, he says, are a great tool that we can learn a great deal of information from if we use them objectively and critique them realistically. I mention that because we will discuss drills here, including a talk this afternoon about Top-Off 2 last year. The key issues that Brian sees are the following. Training, more interagency training. That very much dovetails, by the way, into our thrust here with respect to interoperability. He goes on to say that the need to work with each other, from understanding command structures to equipment and SOPs, standard operating procedures. With today's budget cutbacks, how do we effectively train and maintain that level? He talks about involving the business community to pre-plan for biological incidents. He says we currently are working with the Postal Service, for example, so they can develop a pre-plan in the event that they have an incident. The plan is to be more than call the fire department hazmat team. And then he goes on and says finally that the development of contingency plans in the event that multiple events happen across a state are very important. He says if those happen, the normal resources that you rely on, such as a civil support team, may not come. Then what? He asks. So those are just some thoughts from somebody in a very different setting than we are in today.